to JAT Chat, presented by the Journal of Athletic Training, the official journal of the National Athletic Trainers Association. I'm Dr. Shelby Baez, an assistant professor in the Department of Kinesiology at Michigan State University, and I will be temporarily taking over hosting duties from Dr. Kira Radzak on JAT Chat for the next few episodes. Today, I have the pleasure of being joined by Dr. Jennifer Howard and Dr. Ashley Goodman. They are the authors of Mindfulness Matters, Use and Perception of Mindfulness Practices Among Athletic Trainers, from an upcoming issue of the Journal of Athletic Training. Dr. Howard is an associate professor in the athletic training professional program at Appalachian State University, and Dr. Goodman is a professor and the director of the athletic training program and gross anatomy laboratory at Appalachian State University. Jennifer and Ashley, thank you so much for joining me today. So starting off, what are some of the potential barriers for the use of mindfulness for athletic trainers?
Well, from both self-care and patient care perspectives, some of the implementation barriers for clinicians is the age-old aspects of time limitations. I do want to get I'm going to talk about the research aspects, and then I'm going to hit the aspect of an age-old aspect of stigma. So some of the things that have the research will say time limitations. Some immediately think that they need to go to an 8-week mindfulness-based stress reduction course that costs $500. I'm not sure if they cost that much, but they do cost. The other aspects are the perceived knowledge of best mindfulness techniques and things, and, the barriers of, can I teach, this? Can I do this? Do I have time to do this? And then also, can I teach it to my patient? And then the aspects of cost. So time and cost are some of the bigger ones. I think one of the biggest barriers that we need to get around from this and work-life rhythm as well is to stop the stigma. And that can be the aspect of stopping the stigma around mental health, and then some of the practices to address mental health. But for centuries, we have known about, in the athletic training, about the mind-body connection. And if you look at from the aspect of stress and anxiety, and anxiety being the most common mental illness, with over 40 million adults in the U.S. just diagnosed, with that. And the American Psychological Association putting out their Stress in America survey, and how we're putting that around 2020 and the COVID, pandemic. Mm-hmm. They're sounding the alarm of, that we are facing a national mental health crisis that, could yield serious health, physical, mental, and social, consequences for years to come. And so what I think we asked to break down the stigma of what mindfulness practices are and what they are not. And we start with that mindfulness practices do not have to be this vision that I have to sit in the lotus position for 30 minutes or even 10 minutes, and I must clear my mind. That is the opposite of what it could be. So if we try to start to break down the barriers of what it is and what it, is not, I think that would start to break down a lot of the other barriers. And therefore, that mindfulness is not that, that 30-minute clear the mind aspect that you have to do every morning before your morning coffee. That mindfulness is available to us in every moment. It can be the 2 deep breaths that you take before accepting that call from the disgruntled coach or parent. And so I think if we look at it from an aspect of becoming more aware of our thoughts and emotions, we're better able to discern what is deserving of our attention and what is simply noise, from the stress, of the day. And then to not quiet the mind, but to be kind of more aware of our thoughts and feelings without getting caught up in them. And so that not every thought and feeling that passes through is factual or important, that it may simply just be a passing reaction that we need to observe non-judgmentally, and I'll say that's one of the hardest things for me to do, but that they will pass with time if you just take 2 deep breaths in that moment. And so we talk about with our patients and things and getting out of their own head, and athletic trainers are, no different, from that aspect, but providing that awareness and breaking down that stigma can help us kind of, what can we control in life? There's not many things that we can, but our thoughts, and most of the metacognition level of it is not so much sometimes the thoughts, it's the thought about the thought or the feeling about the feeling. I shouldn't be having these feelings, and then strap into the emotional roller coaster. And here we go. So that we can be aware and then start to control, potentially those feelings before we feel like they're controlling us. And if we talk about mindfulness from that aspect, that it doesn't have to be this long thing. It can be these brief, impactful mindfulness practical practices that we can use. 30-second or 2-minute meditations, 4-8 breathing that you inhale for 4, pause, exhale for 8, pause, and do that 3 times. Or from the aspect of doing 5, 4, 3, 2, 1 with the body sensations, 5 things you can see, and then you go down from hearing, touch, taste and smell. And taking those 30 seconds. And if you keep doing those aspects, and you can kind of start to actually, research has shown, change your brain. And therefore, we can then maybe approach the aspects of the stressors of the day or the factors that impact our personal or professional, life and rhythms and those conflicts in a better headspace. So first, breaking down the stigma, I think, is key. And so those barriers of time, finding brief mindfulness practices, of cost, looking at what your institution has, and also from the aspect of the secondary school setting, there are just lots of organizations and things that are doing things from mindful schools. And I'm kind of getting into some of the recommendations, but so I don't mean to jump ahead on, but,
no, you're good.
Yeah. So, looking at those are some of the barriers, the biggest being the stigma.
Yeah, I think you started already leading us into the recommendations piece, which I think is great. And I really appreciate you mentioning that it doesn't have to be this 30-minute practice, that you can channel mindfulness in just a matter of 2 breaths. I'm curious, if you have any additional recommendations, maybe different strategies or techniques that someone can use to maybe start to figure out how or when they can implement maybe that 2-breath mindfulness recommendation that you provided? Sure.
So some of the recommendations that we talk about, from the aspect of practices is, yes, in this day and age, there are smartphone apps from Headspace to Calm, and they do have levels of 5 to 10 minute, meditation sessions that can guide you, through that. And however, some of those aspects of the 4-8 breathing or the 30-second Qigong or Tai Chi, movements, that do an aspect from also channeling energy, or just 30-second things that you can do before a meeting, or there are other aspects on mindful.org that give walking, meditations, things that mindful eating aspects. So there are other aspects of brief yoga and Tai Chi on YouTube channels. Those are some options. And then there's, also what we try to get into is some aspects of metacognition, and just taking a moment to say, I'm thinking, and hit it in a non-judgmental way, or just even sitting there for a moment and unplugging for 30 seconds. And we will do just what it feels like to feel their feet on the floor, sitting in the chair or standing, or in the 5, 4, 3, 2, 1 aspects of the body sensations. The other thing that we do sometimes is a 30-second rant. And that can be, sometimes do 30 seconds to 3-minute rants. and they can do, and I ask them to take their screen. They cannot see their screen. They'll put a shirt over it and things like this is what I'm talking about from my aspect of my students. And they will just type. If those that don't want to do that, it's a 30-second to a 3-minute doodle that they'll do. Some aspects of, those are some, and then looking and incorporating those brief mindfulness practices both in the workplace for the athletic trainer. So I think some of the things that we didn't talk so much about in terms of some of the demographics, and those females, were prioritized over males, but those that were single and without children were more likely to be practicing, mindfulness. And that makes sense. When you go home, often sometimes your life is not your own, from the aspects of children and spouse, needs and things like that. So what can we do within brief mindfulness practices within the workplace? And there are institutions that are using co-root mindfulness, like our institution, that are doing that. But what can we give the athletic trainer, while they're in the workplace? Those are some of the things that I think we need to incorporate, because if you give that to the athletic trainer in the workplace and they start to integrate it into their personal practice, it becomes better integrated into their clinical, familiar with those techniques, and then hopefully more comfortable teaching them to their patients. Because the emerging research is one of the strongest predictors of using mindfulness practices in clinical practice is actually practicing yourself. And we found that with meditation. So those are some, go ahead.
I was going to say, and I think from looking at barriers from a clinical practice standpoint, it's part of the mental health stigma and the need to change it from this doesn't need to be a reactionary thing. There's an element of prevention. We look at what we've come with from prevention exercises, from whether it's, knee injury prevention or ankle sprain prevention. We now know we have all these tools that we can try and prevent that. Well, mental health's the same way. Trying to learn mindfulness when you're already in mental distress, because it is a skill, it is a practice. It's sometimes you can do it then, and it's still important, but it's going to be much more effective if you've laid the groundwork ahead of time to help, both from a personal and a clinical standpoint.
I think that's a fantastic thought, especially with mindfulness. And because we're always going to face challenges in our life, right? It's about developing the skills and the techniques for us to be able to handle that stressful time when we face it, because no doubt we're going to face it. And Ashley, I really appreciate this concept of controlling the controllable that you're sharing. And I hope those who are listening today will take some of those tidbits that you all recommended. So just wanting to shift the focus just a little bit. And I think throughout the conversation, the concept of work-life balance has been integrated. But just wanting to just explicitly ask, how does mindfulness fit into this discussion on work-life balance, work-family conflict, and burnout in athletic training?
Well, as we talked about from the aspect of mindfulness, having positive outcomes from the aspects of reducing stress, and anxiety and even burnout, from that aspect. Like I said, approaching some of these factors that impact work-life balance and rhythm from a better headspace, and I believe will help the athletic trainer kind of become more aware of kind of their thought process and where they're at, so that they can potentially approach the athletic director and have those difficult conversations from a better headspace of, I am undervalued and overworked and underpaid, and being able to, I like from the aspect of, stress is a kind of happens from an aspect of a threat, to a situation, and anxiety is the anticipation and then a reaction, to the stress. And if we go into those conversations and go into those aspects of how to improve our work-life balance and how to feel like we're making a difference for us and our fellow athletic trainers, if we can approach that from a better headspace, then perhaps we can actually make a better argument for ourselves. From the aspect of burnout, I talk a lot about burnout from Emily Nagoski and her sister's book, Burnout, Completing the Stress Cycle. And a lot from our students' perspective, and then from our clinicians' perspective, is if you are able to become more aware of yourself and your thoughts and the feelings from a non-judgmental perspective, but you realize I am in a freeze mode. So that reaction that you have to a threat, fight or freeze. And often we get into the freeze mode and we just get stuck. If you're able to become aware of that, I am in a freeze mode, then you're able to recognize that non-judgmentally, but use your tools as a way to complete the stress cycle, whether that's from a physical standpoint of exercise or a big old cry or laugh, But you first have to become aware that you're there, So when, and I'm going slightly off topic from the aspect about one of the things that I do with my students a lot is talking about you in this aspect of imbalance and conflict. And when you're often on the waterfall of emotions, thoughts, and feelings, and it is pounding down onto you and all of these thoughts and the feelings about the feelings and things like that. If you were to just step out, take 2 breaths, deep breaths, and step out onto the riverbank and watch those thoughts, feelings, emotions come down non-judgmentally and watch them flow down the riverbank, then you're able to maybe combat that difficult conversation with the coach, with the athletic director, with the parent, and potentially a better way and have a better outcome. So if we could, I feel like it could be a really good catalyst to address some of the aspects of work-life imbalance and, dysrhythm for an athletic trainer. I think it's a great catalyst to start from a better headspace.
No, I think that is super helpful information. So this article is being featured in conjunction with others that focus on work-life balance in athletic training. Mm-hmm. Do you all have any recommendations on how we can continue to elevate this conversation on work-life balance, work-family conflict, and burnout within the athletic training community, even separate from the integration of mindfulness?
Well, first, having conversations like this is a great way. And I think also, having those honest, conversations about the environment and the culture that we're in and how to break down those barriers and these cultures that we should all have our stuff together and not sweat and look like look like the duck, that, or the swan, that is beautiful and graceful in the water, yet paddling frantically, underneath. And then look, and how can we, what are some practical ways, to look at these environments that are often not conducive to implementing mindfulness practices? A lot of athletic training facilities and clinics are very busy and not one-on-one. So can we look at some aspects of having, focus group or group-based interventions and talking about mindfulness and talking about some of these things that have been in the research of how to improve, your work-life balance. This work-life balance, mental health, mindfulness practice, they aren't sexy. They are, and it's not dry needling. Not that dry needling is a bad thing, but it's but we need to, it's a very important aspect that if we don't take care of ourselves, we will not be able to take care of anyone else very well. And Dr. Howard had a great aspect of analogy of the aspect of prevention. Do you remember what we talked about the other day?
Yeah, that I think part of it, like I said earlier, is thinking about it from a prevention standpoint before you're in the problem. And part of that comes from an education. And where are we talking about it? Where are we having dialogues? Are we training our students to have difficult conversations, whether it's with themselves and figuring out, okay, what's a thought, what's an emotion, what's a feeling, and what's my identity? And difficult conversations with their student athletes and their coaches and their supervisors and their physicians. And how do we model those things to better prepare them for what are real stressors they're going to have to deal with as professionals?
Mm-hmm. And I would also say, one of the most important components of successful and consistent, mindfulness implementations and also self-care implementations is often educating your stakeholders and learning, from an aspect of not only what being mindful means, but then also having to set a boundary. And so I also agree with Dr. Howard that we need to make sure that we are educating our students on, yes, conflict resolution, but effective communication and how to set a boundary and how to adhere to that, to those boundaries. And then how to advocate for themselves. We talk all about being an advocate for the patient. We also need to teach our students and our clinicians how to advocate, for themselves and how to present the data. And so if you come at that from a better headspace, instead of a very anxious, state of mind, I bet you'd have a better conversation with that AD or that coach. So I also would like to put a big punch in for that our students need the hard skills. Absolutely. We have got to focus on incorporating the soft skills more into our educational programs and even offering them to our clinicians.
Well, I certainly appreciate those recommendations and that conversation. And I'm glad that things like this can help to elevate that conversation. Do you all have any final thoughts for our readers and our listeners as relates to any of the topics we've discussed today?
I think mine would be, give it a try. Like a bad workout is better than no workout. Some what you may feel like, or you shouldn't label it, but a short mindfulness practice, much like Dr. Goodman has talked about, is better than no mindfulness practice. And waiting for the right time to start a new habit or to implement something new clinically, we know perfection doesn't happen. So go for it.
That's well said. I would agree.
Well, wonderful. Well, Dr. Howard, Dr. Goodman, thank you both so much for joining me today. This article is available free of charge by the Journal of Athletic Training. So I highly recommend everyone go and download this current manuscript when it comes out in an upcoming issue. So again, thank you both so much. And we will see you all on JAT Chat the next time.